During this presentation, I want to tell you the headlines of our findings, introduce you to the methods that we used in making these recommendations, walk through the results and recommendations by setting, and then talk a little bit about the limitations, give you a flavor for the kind of comment we got from the public before opening it up for question and answer. So first, let me give you the headlines. Among our most important findings were that school settings provide a realistic, evidence-based prospect for increasing physical activity among youth. This represents a prime opportunity for federal and state leadership to advance the implementation of quality physical activity programs in school settings. Other settings, particularly preschool and the built environment, also show great promise and warrant continued implementation and continued emphasis on the research. Multiple stakeholders, including transportation, urban planning, public safety, as well as public health departments and other professionals in health, have an interest in promoting physical activity among youth, and our findings demonstrate that this goal can be met in a variety of ways. And in addition, among our key findings is that there continue to be gaps in our understanding of how to increase physical activity among youth, and these gaps need to be addressed with ongoing research. Let me now turn to the methods that we used in drawing our conclusions. We used a review of reviews approach to assess the current literature on interventions to increase physical activity among youth. We included peer review research articles from January 2001 through July 2012. The review of reviews consisted of 31 review articles, and those represented 910 studies. Here you can see the inclusion and exclusion criteria that we used. I'm not going to walk through each of them, but let me say that the key inclusion criteria was the measurement of physical activity as an intervention outcome. Physical assessment measures were included, device-based measures, self-report, as well as direct observations. The aim was to include literature on youth with disabilities and youth across a range of racial and ethnic and social economic backgrounds. And now, even though the original guideline did not start with age 3, we included younger age children because of the importance of physical activity in younger age groups. The review of reviews process included a literature review team from Washington University, Washington University, and they developed evidence tables. The evidence tables included information such as the year of publication, the objective of the research, the type of review. It included narrative on the design, whether it was a randomized controlled design, perhaps, or quasi-experimental design. It also included information about the study populations, independent variables, and dependent variables within the studies. The intervention information was included in these evidence tables, as were results, and we used that to develop the level of evidence that we felt comfortable with for the study. On this slide, you see the levels of evidence that the committee determined. We determined a review to have sufficient level of evidence if the findings showed consistent beneficial effects that were documented across the studies and across all the populations. We determined the evidence to be suggestive if it was reasonably consistent, but one could not make a definitive conclusion. Insufficient if there was not enough evidence to make a conclusion. Emerging evidence was determined as the category when there were new data and it was evolving rapidly, but there were not reviews that existed. And finally, no evidence was the categorization when evidence within the review articles did not exist. and no effect, evidence of no effect was determined when there was a consistent lack of effect in the documented studies. We looked at the settings shown on this slide: school, preschool, community, family and home, and primary care. I'll note that within school, the school setting, we had multiple subsettings, and I will describe those in a minute. Within the community setting, we also had subsettings. Those included the built environment, camps, and youth organizations, and then other community programs. I'm going to go now to the settings and start with the school setting. On this slide, you can see the key message here is that school is a very important setting and provides an opportunity for increasing physical activity because children, 55 million youth and children are enrolled in school, and yet, as you can see at the bottom, the amount of activity is not nearly what it could be in school settings. So now to turn to the various settings, subsettings within the school setting. Excuse me, I think I might have skipped a slide. These are the subsettings within the school that we looked at: multi-component school-based interventions, physical education, and active transport were the ones that had the strongest effect. We also looked at activity breaks, the physical environment, and after-school interventions. The multi-component school-based interventions were ones that had among the strongest evidence, and so let me just define that for a moment. These were interventions that included 2 or more strategies and typically included strategies to increase or enhance physical education. Enhanced PE is characterized often by increased amounts of time for students to spend in moderate to vigorous intensity physical activity. It also typically adds more physical education classes to the school curriculum, lengthens the time for existing physical education, and increases the amount of physical activity that all of the students receive during those education sessions. It typically includes physical activity that is appropriate for youth and children with disabilities, and often includes activities that train the teachers as well.